Birth is not just a physical event. It's a sacred passage, a moment in time and space where generations past and future meet, taking shape in the form of new life. However, for Black mothers and birthing people, this journey has often been marked by systemic oppression and racial injustice. To the discrimination in modern healthcare systems, the fight for equitable maternal care persists. And the solution? It may actually take us further away from hospitals than you might think. I'm Darren from Push Black, and you're listening to Black History Year. Embedded in our history and culture are the stories of Black midwives and doulas. Rooted in ancestral birthing traditions, these caregivers and community leaders provided not only physical assistance, but also emotional and spiritual support during childbirth. Their practices were steeped in cultural wisdom that offered a holistic approach to birthing that honored the sacredness of the experience. But white supremacy is a way of creeping into everything, including our most sacred of Black spaces. As a result, Black birthing people face profound challenges in the medical system. Their voices silenced, experiences dismissed, and bodies subjected to all forms of cruelty. But a shift is happening though, and it's providing an opportunity for Black birthers to reclaim ancestral birthing traditions that honored our Blackness while safely delivering future generations. We'll dive into this and so much more with our guest, Linda Jones. Now, Linda is a seasoned birth and postpartum doula with 30 years of experiences servicing women across the Bay Area. While actively participating in the natural birth advocacy community, this mother of two, grandmother of four, and great-grandmother of four more co-founded and is the executive director of Black Women Birthing Justice. And as a member of other local birthing collectives, she helps train and mentor women of color doulas and provides meals to postpartum women. Listen, how we're birthed or how we come into this world can set the stage for the rest of our lives. And today, with Linda's wealth of knowledge and experience, we'll uncover what's at stake if we don't bring sacredness back to birth. What's up, fam? Before we dive into the episode, I have one small favor to ask. Please spread the word about Black History Year on social media. Podcasting is competitive, y'all, and the best way to grow is through your promotion. You can shout out this episode or share one lesson from it you found super interesting. Just tag us at We Are Push Black on Instagram and TikTok so more folks can access the Black history they didn't teach us in school. Your support means the world to us, and your minute of effort makes our hours of work worth it. So thank you, fam. Now, let's get back to the show. So we like to open up our conversations with a question for all of our guests, and we want to know from your perspective, Linda, what does Black liberation mean to you?
Black liberation. I guess I have to answer that from the birth prospect of it, the aspect of it. To me, Black liberation is the same as what we refer to as Black justice, where we believe that anyone who's giving birth has a right to give birth or not, to have that baby where they want it, how they want it, with whom they want it, and be able to keep that baby after they have it, if that was their choice.
Absolutely. So you speak about the agency, having choice and the autonomy to choose how you want to bring life into this world. It's absolutely essential for thinking about a liberated Black world for us. I really want to begin with a quote from Leslie Welch and Nashira Burrell from the Birth Center Equity Network. They tell us that at the time our grandparents were born, midwives, known in the community as grannies, attended almost all births, y'all. For our ancestors, community-based midwifery care was not alternative birth care, it was just birth care. The midwife, well known as a healer in Black communities, came to the house and caught the baby. With that said, Linda, I'm curious if you could just paint a picture or describe for us what the Black granny midwife tradition looks like for those of us who've been so far removed from that context.
It was an amazing time. I have to show you. I have this picture on my desk. These are granny midwives. Just so happen to have them with me. The granny midwife was the person in the village who delivered everybody's baby, didn't matter what color they were. And they did more than just deliver babies. They were pretty much the medical care for the community. So if anybody had a problem, they would go to the granny midwife first.
All these your babies, Miss Mary?
Yes, these are all my babies. Delivered about 1,400.
But they were also the one who, like you said, caught babies. They didn't deliver them, they caught them. And they did it knowing and learning from someone before them of how to do this. And these were these women that had their little bag, and they would travel all over a given county delivering babies and doing it well. They kept babies alive. They kept mamas alive. Some of them deliver, caught up to like 3,000 babies in their career. And this was all going along well until people realized that money could be made from doing this. And then they were pretty much ostracized and called dirty, and they had to go to classes and be taught by white nurses. And it just disappeared. They made sure that it disappeared.
Which is why we're so thankful for you and the work that you're doing for the research in this practice. You spoke a bit about the capitalist intent behind it, the money grab behind this. And it makes me think about, at what moment did sacredness get removed from our birthing traditions? So what do you believe makes birth sacred in the first place?
I just feel that birth done the way it should be done is sacred because it is a rite of passage for a person. Women are made to have babies. We do all kinds of other things, but our bodies are made to have babies. Our uteruses are made to produce babies. And it's, I've seen thousands of births as a doula, and I always marvel at the end because they come out, pretty much perfect. And I know that there's times when they don't, but generally they do. And if you were to see a birth and witness a birth that was done without all the medical intervention that everybody's taught to believe they need, you would see the sacredness in it, because you see that person who's giving birth go into her body and call upon all of her ancestors to push this person out of their body. It takes a lot, and it hurts. And it's a hurt that I tell people is hurt with a purpose. Other pain is not, if somebody's hitting me in the head, I don't think that that's good. But I think that the way we use the word pain in childbirth is just because we don't have another word for it in the English language. So pain is, me being slapped in the face. Pain is a bullet shot. Pain is giving birth. They're not the same thing. And so I try to always instill in the people that I work with that they have to kind of reframe that word and take out the harm and the fear from it, because what they're feeling during labor is sacred. It's telling someone like me, as a doula, it's telling the midwife where they are in their labor process. Because I can look at someone after 30 years of doing this and know pretty much where they are in their labor journey, whether they're at the beginning of it or whether they're about to push their baby out, because of the way they act, the way they smell, the way they sound, the way they talk or don't talk. I can tell that. But if they're medicated, I can't, because they just look like me right now. You don't know what's going on in my body right now because it's, I'm medicated, and all those things are taken away from the process. But if you were to see someone giving birth that way, you would see the sacredness in it, because it's beautiful. It really is beautiful.
Thank you so much for that rich response. It makes me want to jump to another point really quickly, because you speak about the ways in which birthing is normally talked about as a painful and traumatic experience, all the fear mongering that's associated with it. I'm just curious, at a very broad level, what do you think the media really misses with regards to depictions of pregnancy, depictions of birthing? Do you feel like it's been distorted for us somehow through the media?
Of course it's been distorted, because our whole country right now is reigned and controlled by fear of whatever. And fear in birth is a big thing that everybody knows about. You hear women say, I'm afraid to give birth. I'm afraid to do that. And this was even before all of the big headlines about how Black women are dying 3 to 4 and sometimes 12 times more than, other people, especially white people. I'm going to die just having a baby. I'm so afraid. And the medical profession seems to use that to control the narrative of how they want them to birth.
Wow.
So, if you tell somebody that they have to come in right now to have their baby and be induced, which to me just all of a sudden seems to be a new way of telling people they can't give birth and go into labor anymore.
Yeah.
But it's also, to me, it's a good way for the hospital to make money because they get to use all the stuff and all the drugs, and they're there for 3 to 5 days instead of just 1 day, and they usually end up in a C-section because the body isn't ready to give birth, so they can't force the baby out, and if they're lucky, the baby then goes to NICU. So there's a lot of money involved in inductions. And so when that happens, it takes away from, it adds to the fear. It adds to all the things that they're afraid of. And then the doctor will say, well, if you don't do this, I'm afraid your baby might die. Or if you're 41, the research shows that if you wait and go to term, you may have a stillborn. All these things that they tell them that, it might happen, but what are the odds of it happening? Is it 1 in 100 or is it 1 in 100,000? And are you really willing to take that risk? So I always tell people, have them explain to you what it is, how does it apply to me personally, not just a statistic.
Absolutely.
We have a lot of things that just being Black, we're at risk for. Being pregnant and Black is a risk factor, just right off the mark. Being Black and a certain BMI number, you're at risk. Being Black and being a certain age, you're at risk. Being Black and have had a C-section before, you're at risk. So there's a lot of things for people to be afraid of. And so there's a lot of fear involved. And I would tell people that my biggest job as a doula is to take that fear away from the room, because I'm the only one in the room probably that's not afraid. The doctors are afraid because they've seen all these horrible things. The patients are afraid because they are scared. And I'm not, because I assume that birth is going to be just fine, and I'm there to try to help that happen. So.
Yes, ma'am. This makes me think about the pathologizing of Black mothers and Black birthing people. You spoke a bit about the BMI and the other fear-mongering tactics that kind of thrown out there. Do you feel like the narrative around Black maternal health in this particular country, do you feel like it places blame on individuals versus institutions, or blame on certain communities?
It can seem like that because if everything is, started out by saying, well, you're Black, so, it's like, I can't help, I'm Black. But that's not the reason that all these things are happening. It's the fact that they're Black in America, and the systemic racism and the institutional racism that they put themselves in when they go to a hospital to give birth. So they have to be able to navigate all that. And the reason our women are dying is not because there's anything wrong with them because of being Black. It's because they aren't listened to and they aren't taken care of the same way someone that's not melanated is taken care of.
Yes, indeed. You spoke a bit earlier about how knowledge was passed down generationally within the Black granny midwife. I do want to provide a little bit of a historical context with regards to when did the medical industry rip birthing away from the community?
Better late this morning.
I see.
2 days ago, a baby delivered by a midwife died when it ought to have lived. As your health officer, it was my duty to find out why that baby died. My examination showed that his cord got infected, and you all know what that means. Something wasn't clean.
So the 1920s actually brought the Shepard-Towner Maternity and Infancy Act. And for those who are unfamiliar, this act actually legislated and designated funding for physician and nurse supervision and training and oversight of midwives. Now, the Shepherd-Towner Act especially targeted Black midwives as too uneducated and too unclean, as you mentioned earlier, Linda, to provide healthy maternity care. Now, in the year 1900, almost all U.S. births occurred outside of hospitals. However, because of this act and also the Hill-Burton Act of 1946, which, regulated separate but equal hospitals, what we saw was that out-of-hospital births fell from 44%, from almost 100% at 1900 to 44% by 1940. And by the time we get to 1969, only 1% of births were taking place outside of hospitals. Now, the thing that I'm really curious about here, Linda, the co-opting of alternative birthing practices by these legitimizing institutions like universities, medical boards. Have you seen this happening in your own experience?
Oh, of course. It starts with doctors who won't even talk about any alternative care. They tell people it's unsafe, it's unclean to have your baby at home or in a birth center. They talk about how you may not be able to get to a hospital in time. So again, fear that they're doing this. When it comes to the institutions that are supposed to be training midwives, there are not enough of them. There are not enough institutions training midwives. And right here in the Bay Area, we have a little conundrum happening here with one of the only universities that was teaching, had a midwifery course at UCSF. They changed it to now making it a doctoral program. So in order to become a midwife, you've got to have like a master's degree and then go into this PhD program.
Wow.
And there's only a very few institutions in the country even that train midwives. There's one in Florida run by Jenny Joseph. She's the one that got the first accredited midwifery school in America, I believe. But there's very few places where, midwives can be trained to do this. Or they want them to become certified midwives that work in hospitals and then they don't necessarily depending on the laws of the state, the right or the ability to do home births.
Well, Linda, you've been practicing as a doula formally for over 30 years. I'm curious about your professionalization and specifically, how did this generational knowledge get passed on to you? What set you off on your journey as a doula?
I believe that the universe wanted me to be a doula. I didn't know anything about being a doula. So in order for me to find out about it, I got pregnant at 37 when my daughter was 21.
Oh, wow.
So I was like, oh, yeah, I don't want to do this again. But I ended up, the one inside said, yes, you are going to do this again. And I met a woman in my childbirth class, and I was lamenting about how I was looking for work and I was interviewing in, corporate, which is what I always done before, and just sitting across from people going, I can't do this for the rest of my life. And she said, well, you should do what my friend in New York is doing. She takes care of pregnant women and babies. And she said this because in the short time that she had known me, we had kind of a mother's group of two, and she learned that infants and newborns are my favorite age of people. And the joke around me is that once you hit a year, I'm pretty much done. I don't particularly like kids. There are some exceptions, but I really, really love newborns, and I have this thing with them. So I called her friend, talked to her for 2 hours, and hung up the phone and said, this is my light bulb moment. I can make a living just hanging out with pregnant women and babies for the rest of my life. That's going to be good. And so I had worked at Xerox before in marketing, so I just used what they taught me to put up flyers, and just wherever I thought a pregnant woman would be, I would stick up a little piece of paper and say, call me. And I volunteered with a group here that had like a phone line where people could call in and ask questions. Because again, before the internet, so they would have, a phone line where pregnant people would call and say, I'm looking for this, or I'm looking for that, or where can I find this? And I volunteered to do that for 2 days a week. And someone called me and said, I'm about to have twins. I have a 3-year-old and I need some help. And so I said, I know this organization. You should give them a call. And it was me. And they were my first, she hired me, and that was my first client. Wow. So I learned from midwives in this to be a doula, because a bunch of us that had just gotten trained by a local midwife here, who it was just a weekend kind of training, because she figured we knew how babies got there, how they got out, but she taught us what doulas needed to know about how to emotionally take care of people in labor. And they said, sure. So I volunteered for a year at a local hospital here in Berkeley, near where the clinic was. And the clinic was a clinic run by midwives, and they would see the midwives for their prenatal care, and then the midwives would deliver them at the hospital. So many of them were young Black women, because it was for low-income, uninsured people. I did a lot of work with young Black women during that time. Well, older or younger, I was the only Black one. So if they had the sense to ask, I was there for them. So I did like 4 to 5 births a month for about a year, working with that clinic. And then I was doing postpartum work as a doula outside of that for pay.
Yes.
And so it was such a learning environment for me, because I learned how midwives, take care of pregnant people versus how doctors do it. It's a vast difference. And so also at that time, Medi-Cal would not pick up anesthesia. They wouldn't pay for an epidural. So if you wanted pain relief, you'd have to pay out of pocket for it.
Wow.
So most of them could not afford that. So I learned how to help them when they weren't unmedicated. So that was a really good education. Just how to be with people, the Black nurses in the hospital, how to be with people in pregnancy and birth.
Indeed.
So, yeah.
Wow.
And the rest is history. So now I've been doing it so long, I'm Mama Linda to all these little baby doulas that are coming up now. So
okay, Mama
that's
Linda.
really good.
Okay, thank you for sharing that sacred journey with us.
Yeah.
You teased at this a bit in your response, but just to make it explicit for our audience, what are the differences between a doula and a midwife? What are the differences in the roles, responsibilities, expectations? Yeah.
Nobody knows what a doula is, and the differences are a midwife is much like an obstetrician. They are responsible for your life during your pregnancy journey. They do your prenatals, they do internal checks, they measure you, all the things that the obstetrician would do, except they spend a lot more time with you than the 10 minutes that you have with your doctor. Usually a midwife appointment is like an hour long, when they do prenatals. So they spend a lot more time with the people that they're with. Midwives in a hospital kind of have to adhere to the protocol of the hospital, but they still are able to do a little bit of midwifery stuff, to help you. They don't go so quickly to, throwing in the towel. They let people help, do some things, change positions, do whatever, versus a doctor that just says, this isn't working, let's have a C-section. A doula, on the other hand, does not do anything medical. We may know medical things just from being there and observing, but that's not our lane. We're supposed to be there for emotional support.
Yeah.
So we are there to answer questions, to educate, to support during the birth and postpartum. We get you through the labor and delivery, and then postpartum, we help you with breastfeeding. We help you with, food, tidying up the home, helping you figure out what it is you brought home in this 6 to 10 pound package, that nobody knows how to do anymore. So that's the difference. It's medical versus non-medical, basically.
Copy that. Thank you so much for that clarity. You spoke a bit about the postpartum process, and
Yes.
you yourself work as a postpartum doula. What does this country miss around postpartum care?
We don't honor women in birth. We don't honor women most of the time, but especially in birth.
Yeah.
And the postpartum period, I say that's like the sad stepsister of the whole perinatal period, because there's all this stuff about how to get pregnant, how to be pregnant, how to give birth. And then they give you that 6 to 10 pound thing and say, bye.
Yeah.
See you if you ever do it again. There's no medical profession for that period. The obstetrician's done with you because their patient really is the baby, not you. and the pediatrician knows nothing about pregnancy or what's happening with you after and postpartum. So there isn't a lot of places where people can go to get information if something goes wrong. And we lose a lot of our mamas, especially Black mamas, in postpartum. People don't really talk about it. They talk about the birth part, but we're also losing them in postpartum because they don't know what to look for. They have post-eclampsia, so they have all these things that could kill them, but they don't know to look for the signs to go to the doctor because they've just been through birth. They don't know what's normal anymore. I just think it's almost criminal the way we treat this postpartum period for our people. It's, there are many, especially Black women, who go back to work within 2 weeks after having a baby to keep their low income job, but that's a job, but they cannot stay out longer than that. Maybe 6 weeks. You're not ready to go back to work at 6 weeks postpartum. Yeah. You're not ready to go back at the 3-month period. You're still not ready to go back at that point. And having a year postpartum in these other countries, they understand that is needed. It's time with your baby. It's time to bond with your baby. It's time to learn your baby. It's time to love on your baby, take care of you, to heal. And you can't do all that in 6 weeks. It takes longer than that. They used to say 6 weeks was the postpartum period. They've now moved that out to a year. Even Medi-Cal here in California, who started to pay for doulas, they will pay for postpartum help up to a year. Wow. So they realize it takes that long, but still we're still dealing with the archaic time frames of, come back to work in 3 months or 6 weeks or whatever it happens to be. Yeah. Other countries have a laying in period where the mom does not get out of bed for 40 days. Wow. all she has to do is take care of her baby and feed it. Everybody else does everything else. They cook for her. They take care of the other kids. They take care of the new baby so she can get rest. Chinese culture even has like homes that you go to where they take care of you during this period. Here in America, the person who's jogging around the lake with her stroller, those are the ones we go, oh, look at her. She's back up and going. She's only been 2 weeks. That's not what it's supposed to be. I try to encourage our new moms to stay home for at least 2 weeks, but you can't keep them in. They're at the mall, they're at the store, they're at Target, whatever. We even have one of the programs I work with, we provide them with this huge bag of like $300 worth of products that they probably didn't know they needed for postpartum, because we don't want them in Target with a newborn baby 2 days old. We want them to have all the stuff that they need already, because in a perfect world and in other cultures, people know what they need and they bring it to them, but not in this country. And then we also isolate moms in postpartum. And when you hear people say postpartum now, they're usually referring to postpartum depression. And that's two different things. The postpartum period is just that time after you've had a baby. I say postpartum lasts for the rest of your life if you've had a kid, because that's what it is. But postpartum depression is a whole different thing. That's a mental malady that people can get if they're left in isolation too long, or just from the hormonal imbalance of having a baby.
Yes, indeed. Yes, indeed. Before we transition to talk about the reclamation of our birthing traditions and practices, I just want to emphasize the impact of doula care. So, according to the CDC, doula-assisted mothers were 4 times less likely to have a low birth weight baby, 2 times less likely to experience a birth complication involving themselves or their baby, and significantly more likely to initiate breastfeeding. We have some more stats here from the World Health Organization regarding midwifery-led care and how it's preferable to physician-led care. They tell us that lower maternity mortality and reduced stillbirths and preterm births are a feature of midwifery care, as well as lower use of unnecessary and potentially harmful interventions like C-sections for low-risk deliveries, and overall improved patient satisfaction from the psychosocial level to spoke about postpartum depression. But with all these stats laid out, Linda, it seems like there's so much overwhelming evidence to the vitality of alternative birth care. But I'm curious, how do you specifically navigate any resistance or skepticism from mainstream healthcare systems? What does it take to kind of convince those who are birthing for the first time that, no, this is actually safe and preferable to what we're normally taught?
It's hard to do. For the first 25 years probably of my practice, I worked with white women because they were the only ones who knew about doulas. It wasn't in our community. It wasn't a thing. Or if they even heard about it, if they heard of doulas and midwives, they thought it was for white people. It wasn't for them. It was like this hippie thing that people did. They didn't realize until the statistics started coming out about, you know, the maternal deaths and stuff, that they needed somebody else to help. So it's a hard one to fight against when you have the doctor profession. You know, when you get pregnant, the first thing you do is you go find a doctor and you have the baby in the hospital and you do what he says. And it's usually a he, you know. Wow. And so that's been going on, like you said, since 1920. So it's a hard one to fight against. And all we can do is keep educating people. The fact that we're now being funded to work with low-income moms, we're hoping that they will pass the word to their friends that this is the birth they had versus, you know, births they've heard about from their sisters, cousins, mothers, whoever. And we try to make it a better experience so that they will have a better experience to talk about. Here in California, like I said, we passed a bill to pay for doulas now. So everyone who's pregnant can have a doula for free if they're on Medi-Cal. And that all sounds good until you realize there's not a lot of doulas that are qualified yet to be Medi-Cal providers. So we're working on that. And one of the things that I'm doing with Black Women Birthing Justice, which I'm the executive director of, is to train 100 Black women here in the Bay Area to be Medi-Cal providers so that women can have someone from their culture be their doula. So it was a long battle of myself and about 5 other doulas, experienced doulas, who sat with the state and put together this bill because we didn't want them to come up with something that was ridiculous. So it's still a battle. It's still a battle, but we're trying to get there. You know, we're trying to get there, and so that people can take advantage of having, you know, a doula at their side at their birth.
Absolutely. Thank you so much for your work and just shifting the medical infrastructure so we can reclaim these traditions. I want to transition a bit and talk about just the sacredness of birth and community healing, and specifically how this is advanced through your educational initiatives and just your practice as a doula. I want to share this quote with the folks from an indigenous midwife named Barina V. Farrell. And she tells us that to bring ceremony back to birth is the radical process of rehumanization and connection to the divine. This connection to the divine. I'm curious, where does sacredness fit in as your work as a doula? How do you honor sacredness within the birthing process?
I think what doulas try to do is bring a little spirituality back into it, especially doulas who work in community, because we do need to show them a different way, you know, a different way to have their babies. And if we can instill in them that there is some tradition, there is some culture to it, it helps. I think it really helps. They see the kindness that doulas provide. They see the fact that someone really cares about them. It's not just, you know, it's not like the Ford factory of the hospital. It's like, you know, we care about you as an individual. We care that you carry your baby to term, that you have a healthy, full-term size baby. Prematurity in the Black community is so prevalent that everybody thinks that they're supposed to be having a premature baby. And they're not. You're supposed to go to 40 weeks. You know, that's how long it takes. But most Black moms don't. And so there's a high incident of prematurity. So we try to instill in them that, yes, it takes that long And yes, you might be tired by 38 weeks, but that's not a reason to throw in the towel and be induced. So, let's keep this going. Show them ways that it is sacred. We try to do little ceremonies. We try to tell them how, when they go, if they go to the hospital, they can make the room look like home. We tell them to bring music. We bring an infuser so we can have some, nice aromatherapy going on, so that it's not so clinical, because this isn't clinical. If in a perfect world, they would be having it at home with all these things around them. And then we take care of them. We hold them, we let them cry. We listen to them, which, the hospital didn't have time for that. They really don't. And then on the other side, in postpartum, we love on them. People bring them food. I don't cook for anybody, but some doulas cook for people, and make them really good meals that are good for postpartum. Show them how to take care of this baby they brought home. Don't just leave them alone with a crying baby, which most people have if they don't have a postpartum doula or someone like that. Sometimes your mom or your sister or a cousin or somebody could help you do that kind of thing. But that also comes with all that it comes with of having your mom help you. So I say, I'm like your mom, but if it doesn't go right, you don't ever have to see me ever again. So it's non-judgmental help, that we bring. We don't judge people for what they want to do. Breastfeeding is a big issue in the Black community because, our numbers are going up, but there's a lot just culturally that stop us from breastfeeding. Our partner doesn't want us having our breast out. Our mom said she didn't do it, so why do you have to do it? Your grandmother's like, what are you doing? We stopped that. We had to, we were forced to breastfeed other people's babies. Why do you want to do that? So it's all this stuff that's all convoluted in our culture and our past, that says don't breastfeed. Yes, and indeed. It's the best thing for your baby.
Yes, indeed. I just want to lift up this moment. I came across this fact in doing research and preparation for this conversation with you, just on the note of breastfeeding. I learned that in 2018, the United States actually shocked the world, specifically like World Health Organization, because they staunchly opposed a UN resolution saying that mother's milk is the healthiest for babies. And instead, the US was trying to suggest that mothers and countries should work to curb misleading marketing campaigns around producing baby formula. And I can't think of anything more just anti-human or dehumanizing than that to suggest that, no, actually formula is healthier than what we've been doing for like millennia as human beings here.
Yes, exactly. And then, last year, I think it was last year, maybe the year before, they had the big formula recall. So there was no formula to be had because they found some bacteria in the formula. So it was gone off the shelves. And so now what do you do if this is how you're feeding your baby? Your body's not going to do that.
My goodness.
Our breasts are lovely and they're used for lots of things, but they're made to feed your baby.
Yes,
so we need to normalize that.
So we've talked about reclaiming the sacredness with regards to our birthing traditions through community, through education, whether it's around the postpartum process or dispelling some of those fears. But I'm wondering if you could share any rituals, any kind of practices that you use to connect birthing folks, birthing mothers with their spirituality.
One of the ones that comes to mind is the thing that we call closing of the bones after they have the baby. And it's something where, once a woman has a baby, their bodies are pretty much changed forever. And so we want to try to bring their bodies back together, both physically and spiritually. And so we have this ritual where you lay them down and wrap them really tightly in cloth. It's almost like swaddling them, like you swaddle a baby. But you wrap them and you massage them and you wrap them and you cover their head and you have aromatherapy going. And it's very, very powerful. Most times moms, either they fall asleep or they cry or both.
Oh.
Because it's so healing to have that done to you by someone. It shows so much love to do that and honor the fact that they've given birth and then now they've moved from one plane to another, and to just close that whole birth process and make her body ready to go on for whatever comes.
I'm curious around some of the communal impacts of birthing through this mode versus this kind of medical assembly line, as you kind of mentioned earlier. What are some of the impacts you've witnessed that birthing in this space has on the community? So beyond families.
I just feel like if a mom is treated really well during that whole process of being pregnant and giving birth, and she's gotten good nutrition and she has a good place to live, and her other kids, if they're already there, taken care of, her partner is good to her, if all those things are in place, it impacts the whole community. It really does.
Yes.
The problem is that we because of racism in this country, most of those things are broken somehow. We have so many people that are unhoused and pregnant. We have so many people who don't have the right kind of food to nurture their baby. We have people that are so stressed, they have premature babies. And so, in a perfect world, I would make sure that all moms had that kind of safety net to do and be. I used to work at a community advisory board, and one of our tasks was to review grants that people put in for stuff. And I would say, why are we paying these white women this money to research stuff that we already know the answer to? Take that $40,000 and give it to a low-income mom and let her have a good place to live, have good food, her kids taken care of, all the stuff. I guarantee she'll bring her baby to term and won't have a preterm baby.
Absolutely.
But we don't do that. We research the same old stuff that we already know the answers to and do nothing about it after we find out the answer that we already knew. It's a ridiculous cycle.
You spoke a bit about in a perfect world, and this leads me perfectly into my next question. In a completely liberated Black future, what does Black maternal health and reproductive health look like? What does it feel like?
It looks like teaching young girls at middle school about birth, about their bodies, about their choices in giving birth. We can't wait till somebody's 35 to try to change their mind of what they've been indoctrinated in. That's very hard to do. Like the other question you asked, how do we change? It's hard to change somebody who's heard this their whole life. But if we can get to someone who's 12, girls these days are they start their menses at 9, 10, 11 years old, and they have no idea what's going on. I was flabbergasted to find out just a couple weeks ago that in the Bay Area, young girls have trouble getting period supplies, low-income people, because they can't afford to buy them. And it came to light during the pandemic because they usually get them at school, but the schools were all closed, and so they couldn't. And I'm like, our organization is supporting a young woman in Africa who is making making reusable sanitary pads. But it never dawned in my head that this was a problem in Oakland, California in 2024. Or that the girls are shamed by having a period. This is wrong. We need to get to our girls much younger and explain to them and to boys what menstruation is about and all the stuff, how their bodies work. We have 30-year-old women who don't know what's down there. It's craziness. So in a perfect world, we would teach them younger, teach them about doulas and midwives, home birth center births, that they don't have to necessarily go into a hospital to have a baby unless there's a really big medical reason to have it. We would have black midwives and black doulas for anybody who wants them. You know, we would have organizations that are training our black midwives without, you know, all these barriers in place, because we need midwives. Midwifery care, like you said, has been shown all over the world to be have better outcomes than doctors. You know, you very, 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 very seldom hear of someone in midwifery care that passes away or dies, or their babies die. You don't hear it, because midwives have to be hyper vigilant that does not happen, because they will go to jail. You know, doctors don't go to jail when that happens. Midwives do. So we have far better outcomes as using midwives than we do going to a hospital. So yeah, it would be that, and then everybody would have wonderful postpartum care.
Yes, indeed. No, thank
It's
you.
a long way away, but one day maybe.
Thanks to folks like you, Linda, and the Birth Spirit Equity Network and all the others. Hopefully we can get back there. Thank you so much. When we're thinking about just how has colonization shaped the way that we think about the birthing practice, I came across this fact. I just want to lift this up to see how you respond to it, Linda. I did not know this, but apparently the birthing position for birthing mothers, birthing people, changed in the 1600s because of King Louis the 14th. Apparently, he decided to move the normative birthing position from a birthing stool, which they had in Europe at that time, to this dorsal, like flat position. I'll leave the audience to look up why he made that decision, but I'm curious, Linda, how does that land with you? It just shocked me.
You know, you need to look up Dr. Marion Sims too, who was supposed to be the father of gynecology. He did some horrible things to Black women. But yeah, it's all about convenience to the male who was working. And so that has been, like, since then, the supposed norm for giving birth. And in some very few instances, that might be the best way to have the person be. But gravity helps get things out of your body, you know. So squatting, standing, sitting on a stool, all those things help bring the baby out of the body. Laying flat your back and pushing till your eyes pop out is not necessarily the right thing to do. And people should know that they have every right to birth in any position that their body says to birth in. You do not have to lay on your back and give birth if you don't want to. You know, the doctor will have to figure it out. There's a thing called the Black Birthing Bill of Rights, and people should look that up, because there's a whole list of things that you have rights when you go in the hospital.
Okay, the Black Birthing Bill of Rights.
Yes.
Okay, thank you so much for listening.
Very, very easily to Google that and find it.
Copy. All right.
Yeah.
Well, before we get out of here, Linda, we want to know, how might our audience best support the work that you're currently involved in?
Like I said, I'm the executive director of Black Women Birthing Justice, which is an organization here in Oakland, grassroots organization that helps people have better birthing experiences, have less traumatic birthing experiences. We started this out by collecting birth stories of 100 Black moms here in California and putting them into a research paper that has then been turned into a book called Battling Over Birth, because it is a battle to have a birth that you want here in this country. So Battling Over Birth, you can get it on Amazon, or you can get it through our website. And so I'm now trying to raise funds to train Black midwives or Black doulas for the Medi-Cal provider position. So if they want to learn to be a doula, we'll teach them to be a doula, but they will at the end of it learn how to go through all the paperwork and processes that need to be done to become a provider, so that we can have a pool of Black birth workers here in the Bay Area that can support Medi-Cal people wanting to have a culturally congruent birth person with them.
Copy that. Anything else you want to share with our listeners regarding reclaiming?
I just want to talk about we have a new book. Let me grab it here. This is a new book we have, backwards, but it's called Birthing Justice. This is the second edition of our book. This book is a compilation of all different people, birth workers, midwives, doulas, people who work within that and the birth field, parents that talk about different aspects of birth. I have a chapter in here about Black community doulas and how that helped during the pandemic, what we did during the pandemic to provide support when we were banned from hospitals. So yeah, there's lots of good reading in there.
All right. Well, thank you so much, Mama Linda. I appreciate your expansive knowledge base and your breadth of experience. Thank you for taking time to share that with us and our listeners.
Oh, you're welcome. It's an honor to be with you.
Oh, thank you. Thank you. That was Linda Jones, postpartum doula and executive director of Black Women Birthing Justice, on the sacredness of Black birth. To learn more about her work, visit blackwomenbirthingjustice.com. Until next week, be free. You're living in history. Thank you. At Push Black, we agree with Marcus Garvey when he said, a people without knowledge of their past history, origin, and culture is like a tree without roots. We believe telling empowering stories on Black life and history can build a more liberated Black future. Being here with us lets us know you probably feel like that's important too. You matter. Your choice to be here matters. It lets us know that you value this work, and you make Push Black happen with your contributions at blackhistoryyear.com. Most people do $5 or $10 a month, but everything makes a difference. Thank you for supporting the work. Black History Year is a production of Push Black, the nation's largest nonprofit Black media company. And I'm your host, Darren Wallace. Until next week, be free. You're living in history.